Segment 1. Understanding stress, anxiety, and depression. In today's fast-paced world, stress, anxiety, and depression have become extremely common. Almost everyone experiences stress at some point in life, whether it comes from work pressure, financial problems, relationships, or health concerns. Stress is the body's natural response to challenges or threats. When you feel stressed, your body releases hormones like cortisol and adrenaline, preparing you for a fight or flight response. This response is useful in short situations, but when stress becomes chronic, it starts damaging both mental and physical health. Anxiety is slightly different from stress. While stress is usually linked to a specific situation, anxiety is more persistent. It creates constant worry, fear, restlessness, and negative thoughts, even when there is no immediate danger. Over time, anxiety can affect sleep, concentration, digestion, and heart health. Depression, on the other hand, is more than just feeling sad. It involves long-lasting feelings of hopelessness, low energy, loss of interest in daily activities, and emotional numbness. Depression can make even simple tasks feel exhausting. Many people rely only on medication to manage these conditions, but an important fact is often ignored. The human body is designed to move. Lack of physical activity is strongly linked with poor mental health. When we sit too much and move too little, stress hormones stay high, and the brain does not get the natural chemicals it needs to feel calm and balanced. This is where exercise becomes powerful. Exercise is not just about weight loss or muscle building. It is a natural therapy for the brain. Regular physical activity sends positive signals to the nervous system, helping the body relax and the mind feel safer. Research has shown that people who exercise regularly experience lower levels of stress, reduced anxiety symptoms, and fewer episodes of depression. Even light movement can make a noticeable difference. In this video, we will explore exactly how exercise works inside your body and brain to reduce stress, anxiety, and depression. You will understand the science behind it, the best types of exercises for mental health, and how you can start even if you feel low on motivation. By the end, you will see why movement is one of the most effective and natural ways to protect your mental well-being. Segment 2. How exercise reduces stress in the body. One of the main reasons exercise reduces stress is its direct effect on stress hormones. When you are stressed, your body produces high levels of cortisol. Constant high cortisol levels can lead to fatigue, poor sleep, weight gain, high blood pressure, and a weakened immune system. Exercise helps regulate cortisol by teaching your body how to handle stress more efficiently. During physical activity, your body temporarily increases cortisol to meet energy demands. However, after exercise, cortisol levels drop significantly. This post-exercise drop creates a calming effect, leaving you feeling relaxed and refreshed. Over time, regular exercise trains your body to respond to stress in a healthier way, reducing overall cortisol production during daily challenges. Exercise also improves blood circulation. Better blood flow means more oxygen and nutrients reach the brain. This improves brain function and helps reduce mental tension. Muscles that are tight due to stress begin to relax, releasing physical tension that often contributes to headaches, neck pain, and back pain. Another powerful stress-reducing effect of exercise is its influence on the nervous system. Exercise activates the parasympathetic nervous system, also known as the rest and digest system. This system slows down the heart rate, lowers blood pressure, and promotes a feeling of calmness. Activities like walking, jogging, cycling, swimming, yoga, and stretching are especially effective at activating this relaxation response. Exercise also improves sleep quality, which is closely linked to stress levels. Poor sleep increases stress, and stress further disrupts sleep, creating a harmful cycle. Regular physical activity helps you fall asleep faster, sleep deeper, and wake up feeling more refreshed. Better sleep means lower stress and better emotional control during the day. Even short exercise sessions can reduce stress. You do not need long or intense workouts. A 10-minute walk, light stretching, or slow breathing exercises, combined with movement, can immediately lower stress levels. The key is consistency. When exercise becomes part of your daily routine, your body stays in a more balanced and relaxed state. making it easier to handle life's pressures. Segment 3. How exercise helps reduce anxiety. Anxiety often comes from excessive worry and overthinking. Exercise helps break this mental loop by shifting your focus from anxious thoughts to physical movement. When you exercise, your brain becomes more present in the moment. This mindfulness effect reduces racing thoughts and mental tension. Exercise also affects brain chemicals that play a major role in anxiety. Physical activity increases the production of neurotransmitters like serotonin, dopamine, and gamma-aminobutyric acid, also known as GABA. These chemicals help regulate mood, promote relaxation, and reduce feelings of fear and nervousness. Many anxiety medications work by targeting these same chemicals, but exercise does it naturally. Another important benefit is exposure to physical sensations. During exercise, your heart rate increases, breathing becomes deeper, and muscles work harder. For people with anxiety, these sensations can feel similar to anxiety symptoms. Regular exercise teaches the brain that these sensations are safe and temporary. Over time, this reduces fear responses and panic symptoms. Exercise also builds confidence and a sense of control. Anxiety often makes people feel powerless and overwhelmed. Completing a workout, even a small one, gives a sense of achievement. This boosts self-confidence and reminds you that you can take positive action to improve how you feel. Social exercise can further reduce anxiety. Activities like group walks, fitness classes, or sports provide social connection, which is essential for mental health. Feeling connected reduces feelings of isolation and fear, making anxiety easier to manage. The best exercises for anxiety are rhythmic and repetitive activities. Walking, running, swimming, cycling, and dancing are especially effective. These movements create a soothing rhythm that calms the nervous system. Breathing becomes more controlled, heart rate stabilizes, and anxiety gradually fades. Segment 4. How exercise fights depression and builds long-term mental strength. Depression often involves low energy, lack of motivation, and negative thinking. Exercise directly targets these symptoms. Physical activity stimulates the release of endorphins. It's often called feel-good hormones. Endorphins reduce pain perception and create feelings of pleasure and positivity. This is why people often feel better after exercising, even if they did not feel motivated before starting. Exercise also increases brain-derived neurotrophic factor, BDNF. This protein supports brain cell growth and repair, especially in areas responsible for mood and memory. Low BDNF levels are linked to depression, and exercise naturally increases its production, helping the brain become more resilient. Another powerful effect of exercise on depression is routine. Depression thrives in isolation and inactivity. Creating a simple exercise routine gives structure to the day. This structure helps restore a sense of purpose and normalcy. Even small goals, like a daily walk, can create positive momentum. Exercise also improves self-image. As strength, stamina, and posture improve, people begin to feel better about their bodies. This improved self-perception can reduce negative self-talk and increase self-esteem, which is often low in depression. It is important to understand that exercise does not have to be intense to be effective. For someone struggling with depression, gentle activities like walking, stretching, or yoga are more than enough to start. The goal is not perfection, but consistency. Progress may feel slow at first, but benefits build over time. In the long term, regular exercise acts as a protective shield for mental health. It reduces the risk of future episodes of stress, anxiety, and depression. It strengthens the brain's ability to adapt, cope, and recover from challenges. Exercise is not a replacement for professional help when needed, but it is one of the most powerful tools you can use to support your mental well-being naturally. By moving your body regularly, you are not just improving your physical health, you are building a calmer, stronger, and more balanced mind. Thanks for watching the video. If you found this helpful, please like, share, and follow for more health and fitness related videos.